Hi, this is Sally Morgan, physical therapist, craniosacral therapist, and Tellington TTouch practitioner for animals and people. And this is Tristan, who's a Corgi. And we're here today for another episode of Conversations with a Corgi. And today we're going to talk about mouth TTouch work. Now, this is another thing like the ear work that is fairly simple to do, but has far-reaching implications in your animal's body and in the changes that you can make with your animal doing this work. Tristan's eating my props. The mouth work can affect both the emotional and the physical responses in your animal and improve their ability to focus and learn. So the mouth work is really important for learning. It's also helpful for barking, excessive licking, chewing, biting, hyperactivity. It's important for relaxation. It's a great preparation for dental work or using dental drops. It's good for fear and maintaining health and well-being. So the mouth work can be really important. Tristan's licking me to show you today what licking. See, he's licking me. The reason we need mouth work is for licking. So you want to be able to sit so that you are behind the animal's head and support the muzzle gently in your hand, being cautious not to squeeze the dog. So the first thing you'll do, and I have water here for Tristan just so it doesn't hurt his mouth if my hand is dry or his mouth is dry, but I'll show you first on Madison. She has a tongue and she likes mouth work. That's why she's waiting for more mouth work. So you're just going to support the chin and muzzle in your hand gently, and then you're going to slide back and forth on the outside of the lips on the gums like this. And you can also do little tiny raccoon TTouches. Remember, those are the circles with the very tips of your fingers, starting at the 6 and going around a circle and a quarter back to the 9. Now, one thing we do with horses, and you can do it with dogs, although you have to have a dog that really trusts you and knows you like my dog, is we play the piano on the roof of the mouth. Because in horses, there's a point here where they don't have teeth and they can't bite you, and you can do this. Even so, you have to be very cautious. A lot of horses have really sharp points on the teeth around this area in their mouth because there is a space there. And it is very easy to get cut accidentally with the horse doing absolutely nothing, trying to get your fingers in there. So be very careful when you do this with your horse, especially if you've got a horse that you don't know that much about his dental history. And you perhaps have not had a good dentist look at him since you've gotten him. The other thing that you can do when you're doing mouth work with an animal is just lots of TTouches around the outside of the mouth. Clouded leopard, raccoon TTouches around the nose. And this is a good way to start your animal being prepared for the mouth work. Now, this work is really good for an animal that bites or chews or licks. However, if you've got an animal that's aggressive or has a history of biting, be very, very careful. Now, part of why that is because the mouth is really closely connected to the limbic system, as we talked about yesterday, the emotional center of the body and of the brain. And if you have a dog that's a little bit aggressive and you go poking them in the mouth, you could release things that make the dog really overreactive to the touch. I have done and taught craniosacral therapy for a number of years, and in Cranial 2 for humans, we do mouth work, intraoral work. And even a healthy person who seems well adjusted and hasn't had too much dental trauma, there are parts inside of a person's mouth that are so tight that just the lightest touch will send you into an emotional response of tears or screaming or just pain. So be very, very careful, because a lot of these dogs that are prone to biting have a lot of emotional stuff stored in their mouth that is not going to be easy for them to release. And so you can do it, but you have to be really careful and have the dog really trust you. So this is not something I recommend that you do with a dog that's new to you or a recent rescue dog, and certainly not with a dog that you don't know very well. However, we've always thought in TTouch that if an animal is making movements like licking and gnawing, that they are drawing attention to an area that needs work. So if you can't work on the mouth of a dog that you are working with because he has a history of biting, we often go to an area that is the farthest away from the mouth, which is the tail. So if you have a dog like that who is aggressive and licking and biting and barking a lot, work on the tail first, and that may help you gain access to the mouth in a safe way. Now, from a craniosacral perspective, this is really an interesting point of TTouch because of the connection from the mouth to the tail is through the spinal cord and the central nervous system. So it does make sense that if you have an issue up here, you can address it back here because of the connection of the spinal cord from the head to the tail of the dog or the horse or the cat, or the person for that matter. So as much as the TTouch Mouthwork looks easy, it's going to have far-reaching implications to the animal's nervous system and to their limbic system. So I'll just show you some of this work on Tristan before we talk about that. Hey, Bun, can you sit up so they can see you? Oh, he's fallen again. Get your cheeks both up on the pillow, Biff. Where's your foot? Oh, there we are. Okay, he's in. So I often have a little bit of water when I'm going to work on an animal's mouth, especially inside the mouth. Make sure your fingernails are trimmed. And we just start with some, Tristan, you have to hold your head where they can see you. Just start with some gentle T-touches around the outside of the animal's mouth. And this, even with a dog who has a tendency to be a little bitey, you can do this. So usually on the outside of their mouth. And this is really great with a mouthy puppy. And I have had really good success teaching people who are new dog owners with a little nibbly puppy how to do TTouch work on the mouth. And also give them something you want them to chew on while you're doing this when you have a little nibbly puppy. Oh yes, we're yawning. And dogs aren't used to being touched in this area. They're super sensitive right here at the end of their nose. And see, Tristan's saying he doesn't really like that. So we'll just keep working on his lips. And now I'm just going to get my fingers a little bit wet. And I'm going to lift up his little lip here and do some raccoon touches inside his mouth. And his mouth is really dry. He does not drink enough. We all know that. And if you feed your dog dry dog food, they are habitually in a state of significant dehydration. So if that's the case, go to drjudymorgan.com and learn about better ways to feed your dog. But certainly have some water nearby because the chance of a dog fed a lot of dry dog food having a dry mouth is pretty great. And this is a normal thing to be licking and chewing. And, it's not always comfortable, as I said, to have somebody working inside your mouth. And those people in the cranial classes really just were in a state of upheaval for hours after a lot of mouth work. So it's something you really want to do with your dog. It's really important. And if they're initially a little resistant, just be persistent and give it a few days of trying to do it until you can safely work inside their mouth. Oh, that was a big breath out. So I am now just doing little circles on his gums. Let's try sliding on his gums. Now with a bigger dog, you're going to use this part of your finger. With him, I'm just using the tips of my finger because he's just a little fella. And often they like the sliding better than the raccoon touches. Hi. What do you think, Biss? He says, oh, the front of the teeth. No, no. Good boy. He's a little concerned, but he's letting me do this. He's showing me the whites of his eyes a little bit because he doesn't understand what this is about. It's not what he's used to. And in fact, he's only had mouth work a few times in his life, mostly because he's had some pretty significant emotional trauma when he was attacked as a puppy. So he's had some mouth work related to that, but that was 7 years ago. Now I'm just using my thumb to rub along his upper gums. And you can do the lower gums too, but sometimes the animal's really tight there and it's hard to get your finger in there by the gums. And now we'll just try to play the piano on the roof of his mouth a little bit if he'll let me get in there. Now I know he's not going to bite me no matter what I do. There we go, good boy. Good boy. Oh, he says, I have a gag reflex, Mom. So it's pretty safe for me to work with him. But I've had other dogs that I've worked with, other client dogs in particular. And you can just rub your finger lightly on the roof of their mouth and let them chew as they do that. Good boy. Good boy. Good thing Mom has a napkin right here. So after I do the mouth work, and that's about as long as I would work with a dog, he's very accepting, so that didn't take very long. But if I had a dog that didn't like mouth work, and I had to do several 1-minute sections of work, it might take a while to work with their mouth. So I'm just going to do some TTouches that he likes, some lying leopards on his neck. And this is a good thing to do even before you do the mouth work. Some work on the shoulders and neck, and certainly the ear work you'd want to do before you get into an animal's mouth. Good boy, Tris. Good boy. We have all kinds of hairs on this table. So let's talk a little bit more about the implications for the mouth work. The mouth work, as I said, is good if you've got a dog who is barking a lot. They're drawing attention to the fact that their mouth needs work. If you've got a dog who bites, even if he's, chewing up all the toys in the house, that's biting or chewing. And then an animal that's going to require dental work, this is a good thing to do to prepare them for that dental work. Even though generally in this country animals are knocked out for the dental work, it's still a good thing to prepare them for that work so that they don't have an internal emotional response to the work of the dentist. Now, my sister has someone working with her who is really good, who does all the dentals. She's quick. She doesn't, do anything traumatic to the animal, and they all come out great. We are not all so lucky. There are also many places in the country now where they're doing dental work with a dog while they're not knocked out, and that's a great thing if you have someone who can do that. And in fact, it's a great thing for you to be able to just brush your dog's teeth. That will make a big difference. And the mouth work is a good thing to do to prepare them for teeth brushing. If they've had any kind of emotional upset, as I mentioned, Tristan had a scary situation when he was attacked by some dogs when he was a puppy. That kind of emotional memory is often related to tightness in the mouth. So it's really important to work with the mouth to release an emotional upset. And fear of the vet's office, because of the sense of smell and its relationship to memory. If you have a dog who's afraid of the vet's office because of the different smells there, chemical smells, the smell of scared dogs, all the different smells of people and different species of animals in the office, that kind of thing can stick with a dog and make them fearful when they go back there. So it's important to do mouth work if your dog has that issue. And in fact, you can even just do gentle touches around their face and mouth. Let's see your head, Biss, while they're at the vet's office. Licking. There are a lot of dogs who, when you try to touch their feet, Tristan does this sometimes. Maybe he'll show you if you can see him. When I try to rub his feet, sometimes he just starts licking and licking me, and that would be a good time or an opportunity to do the mouth work with him. And the mouth work is really good for nervousness and stress. And again, that's because of the relationship between the mouth and the limbic system. Now, as we talked about yesterday in more detail, there are many connections between the mouth and the nose to the limbic system, which is the center of the brain that is related to emotions, behavior, motivation, long-term memory, and olfaction, which is smell. in the a center for the limbic system is the hypothalamus, and that is connected with the frontal lobes in the brain and the brain stem. So we have my human skull here. So this is the frontal bone. Underneath of that would be the frontal lobe of the brain, and the brain stem is all the way down here by this hole that goes out. So there are connections from the front of the brain to the back of the brain in the limbic system that is related to the hypothalamus. Now, in the brain stem, we have a very important structure that is related to doing the mouth work, and that is the reticular activating formation. Well, it's part of the reticular formation, but the activating formation, also known as the RAS, and in craniosacral world we have a lot of jokes about the RAS, like your RAS is up if people are really hyper, and that's true in animals as well. The reticular activating formation is an area that is stimulated during stress. Chemicals are emitted there, and it puts the body in a state of stress. One of the responses when you're in a state of stress is to grit your teeth and to hold your jaw rigidly and be prepared to fight. And so the more you hold your jaw rigidly, the more that stimulates the reticular activating system. So you get into this circular thing where you have a rigid jaw, and that creates stress, and the stress creates a more rigid jaw. And this is why people who wear bite guards at night have a lot of problems with their teeth and with being calm. Many people with anxiety have this circular formation going on in their body between the reticular activating system and the biting of the jaw. This happens too in dogs. Dogs that, like my neighbors, they leave their dogs out for hours in the cold weather, and the dogs bark, 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 bark. And that barking is alarm barking because they want to come in. It's cold. One of them's a poodle. He shaved. And, you know, it's like 10 degrees here sometimes at night lately. So a dog like that is in a state of alarm, and the more he barks, the more he is stimulating his reticular activating alarm system, which causes him to bark more, and he just really can't stop barking. And that can happen to a dog in a shelter or a dog that's been in a stressful situation in their life. So it's really important to do the mouth work from a TTouch perspective, just to release some of that stress that's been in this circular pattern from the reticular activating system to the jaw. The other important thing today about the limbic system is that it influences the endocrine system, which is where your hormones are. So the mouthwork can be really useful if you're breeding dogs. And it's also influences the limbic system influences the autonomic nervous system, which again, the autonomic nervous system has two parts, the parasympathetic and the sympathetic system, and you want those in balance. If the sympathetic or the stress mechanism gets too out of balance with the parasympathetic, you've got a dog in stress, and he's in fear, flight, faint, freeze. He cannot get out of that easily without TTouch or craniosacral therapy or other specialized input coming into his body. The other interesting thing is that the autonomic nervous system and the endocrine system are also part of what is including the basal ganglia, which is a part of it's part of the limbic system near the hypothalamus. And that area gets input from the cerebral cortex, which is in the front of the brain, again, here. And it sends signals to the motor centers of the brain, which are, again, still in the front. And those motor signals also go to the brain stem, down in the base of the skull. So those motor signals that go to the brain stem are responsible for posture and movement. And then the frontal motor cortexes there are responsible for a lot of the fine motor movements that we have. Now, this dysfunction in the brain stem is one of the things that they have researched heavily in the last 20 years, and they know that dysfunction there contributes to things like Parkinson's syndrome, tardive dyskinesia, where your hand is shaking and you can't reach for things, and a lot of motor function dysfunction in the body. So it's really important to work with the mouth if you have any kind of like motor planning, motor coordination issues going on in your body or your pet's body. So that's part of the limbic system related to the mouth. Now, another part of the limbic system is the olfaction system, which is the system for smell. And taste and smell are separate systems, especially in land animals, but in animals that live in the water, often taste and smell is combined. Oh, he's falling off his pillows pretty badly here. There we go. Interestingly, as we all know, dogs have a great sense of smell. So in the nose, we have the epithelium, the olfactory epithelium, which are skin cells covered with mucus that live in the nasal cavity of your dog here. And they are also part of that is the respiratory epithelium. The respiratory epithelium does not have nerve cells, and that goes to the respiratory system. But the olfactory epithelium is heavily innervated, and this is why a lot of animals have really good smell. In humans, the amount of epithelial olfactory cells we have is 10 per centimeter squared, which is about 1.6 square inches. In a dog, this olfactory epithelium is about 170 squared, or 26 per square inch. So that is a lot more heavily sense of smell than humans that dogs have. And then dogs have some of the most densely innervated areas in their nose of any animal that we have studied. And they are about 100 times more densely innervated with olfactory epithelium than people. So dogs have a very superior sense of smell, which is one reason why this new thing people are doing called nose work, where you hide things that smell a certain way around an area and then let your dog use his sense of smell to find those things. It is really fun. Anybody can do it. A dog that is not, young and spry can do it. And in fact, they're now allowing dogs in carts to do nose work, like official nose work. So it's really for recognition at shows and things. So it's really a fun thing to do with your dog, and dogs really enjoy it. So this is also part of why when you're training a dog, it's really important to use really stinky treats, because you want it to be fun, and they'll have that emotional memory of the good smell of the stinky treat, and they'll also get to use their nose, which dogs really enjoy smells, as you know from any time you've taken your dog for a nice slow walk. And I can't underestimate the value of taking your dog just for a smell walk. It is a really fun time for them. The mucus overlying that epithelium is replaced every 10 minutes. So that's pretty interesting. You've got a lot of draining and filling going on in your head, as does your dog, every 10 minutes. And that might explain why some dogs, like bloodhounds, they're pretty drooly, and they also have really good sense of smell. So they need to have that mucus exchange in a really abundant amount continuing. And part of what happens when you smell is the little things in the air that create the smell, those little molecules attach to the mucus. And then you taste them, and they go into your body. That's how you smell. So a dog like a bloodhound, of course, would be a little more drooly because he needs that mucus to help him smell better, or to smell more effectively. So odor information is stored in your long-term memory and is also strongly connected to your emotional memory. Again, if you are emotionally calm and relaxed at grandma's house having some delicious treat that she made, every time you smell that delicious treat, like homemade chocolate chip cookies, you will also feel relaxed and calm. If, however, I used the example yesterday of my mom at the dentist. If the dentist smells, which are unusual, we don't smell them in our daily lives, have been associated with a stressful time in your life, then it's going to be really hard for you to get over that and be relaxed at the dentist. And one thing I recommend is bringing on your person, a little dab of some essential oil that you like lavender or peppermint, something, maybe not the best one for the vet's office, or the dentist's office, but something like lavender that's fairly strong. I've used rosemary oil for this, and grapefruit and bergamot as well, because they're ones I really like. And to just have that on your sleeve and take a little sniff every now and then when you're at the dentist office to change that emotional memory of trauma in your past and keep you in a calm state when you're now, an adult and have a better dentist. And this is an important thing to know too if you're ever studying for a test, and let's say it's in an area you're not particularly gifted at and you're very nervous. If you have a nice relaxing smell like lavender oil while you are studying, it will keep you more relaxed. And when you go to take that test, using the lavender oil on your person, again, putting it on your sleeve, which is what I often did, will help you recall the things that you were studying while you are breathing that smell. So all of my notebooks from PT school have a different smell. Some smell like rosemary, some smell like grapefruit, some smell like lavender. The harder classes for me, like cardiology, that smells much more like lavender because I really needed to memorize so much material for that class. And it would have been impossible, I think, without using the information I know about memory and smell. So if I want to recall a lot about cardiology, I suppose I should then go take a whiff of a lavender essential oil. So this is important when we're working with our dogs too, to know that long-term memory is associated with smell. So if you want your dog to really remember something good, have something that smells good to him available at that time, such as meeting a new pet in your house. If you want him to have a good time with that pet, it's good to have something that smells really strong and really good. Like give both dogs some really stinky treats when you're introducing them to each other. Maybe not right away, but that will help them remember that it was a good experience meeting this other dog. And usually most dogs, if you don't have them on a leash, they will work it out on their own anyway. So the olfactory system is closely anatomically related to the limbic system and the hippocampus. And we talked about the hippocampus already being related to motor control. Stimuli are detected by the vomer nasal organ, which is located within the vomer, which is in the roof of the mouth. And this is important because if we've all seen horses when they curl their upper lip up and people think they look like they're smiling, actually that's what we call a flamen facial expression. And they do that, good imitation, Tris, but not quite the same. They do that to send sensory, like smell stimuli to the vomer. Now, an interesting thing occurred this morning. We had another technical malfunction. I was looking at the skull I used yesterday so that I could show you the vomer, and that skull has no vomer. I don't know what happened to it. It came from my sister's friend. I don't know if he lost it or what. But in this skull, you can see here this thing sticking up in the middle that looks like a beak. This is the vomer here. And remember, I talked to you yesterday about the... Come here, buddy. He's having a hard time. I talked to you a little bit about the vomer, and then this organ here, which is also an important part of the olfaction system. What did I tell you about it? What did I say that's relevant now? Well, anyway, this is the ethmoid bone here. And the vomer, as you can see, connects to the ethmoid. And this thing is the one that looks like the peach pit. And this one, I guess that's what I had said, was that this one in this skull actually does look more like a peach pit. And you can see the vomer connects. Now, the front of his head, the vomer is really in the roof of the mouth. When I put this on, it's going to fit so that the vomer, see the roof of his mouth there, it's the pink part. The vomer sits right on top of the hard palate. And if you put your finger in your mouth, you can feel like a line down the middle. That is where the vomer is connecting with the top of your palate, the hard palate in the roof of your mouth. So this vomer sticks way down a nose of like a dog. And in it is something called the vomer nasal organ. And that is connected to the mouth, and that's what allows sensory stimuli to be brought from the nose and the mouth into the brain to the limbic system. So that vomer is your friend. This is what's letting you associate emotions with smell. And that can be a good thing or a bad thing. And then we have the ethmoid bone here that it sits in the middle of. And boy, it's so funny that that other skull doesn't have one. And I can show you on this coyote a little bit of where it would be. here is his hard palate here. So the vomer for him is, I would have to cut him apart, but it's down inside of here. Get that pen in there, down underneath this area. And it's quite long in dogs, and ones with long noses like Tristan's. If you've got like a Pekingese with a little short nose, the vomer is much shorter, or a boxer or a bulldog or a toy spaniel, any of those kinds of dogs with the more smushed nose, they actually have a hard time breathing, and then they also have a hard time smelling. And then because their vomer and their whole face is more pressed in, and as we call it, brachiocephalic, they have a harder time emotionally, because they can't get that transition coming and going of new stimuli coming in. They tend to not have a good amount of mucus outflow and input, and so the mucus builds up, and that interferes with their ability to smell, which can make some of those breeds either weirdly reactive or kind of shut down. And it's partially related to the fact that they can't smell and use their nose and their mouth system as effectively, and that's related again to the limbic system, which is the emotional center of the brain. So, and all of that relates to our topic today, which is TTouch Mouthwork. And remember, it's a nice idea to have a bowl of water when you do this. You can do this even with a little kitty. Tristan, you will not be smelling up that coyote skull. And Tristan, can you sit up again? Just to have a quick review here. You'll start with some clouded or lying leopards on your animal's shoulders and neck, maybe a few slides on their ears, supporting their head gently with your hand. Do some, easy boy, he's falling off his pillows, the little raccoon touches around the side of his mouth. And then get your finger wet, and you can go inside and do those little raccoon touches on his gum. You can also slide your fingers gently there. And I cannot emphasize how gently to do this. Very, very gently. Try doing this in your own mouth, and you'll find out quickly how gentle you have to be, because there are tight spots all over people's mouths, and it is really painful. For instance, you might know this when you go to get x-rays taken of your mouth at the dentist, and they have these big squares they have to squeeze in there, and they're poking you like in the squishy part on the bottom of your mouth. And technically that squishy part shouldn't be painful, but often for people who've had a lot of fillings, crowns, dental work, etc., it's very painful down there. So if you try touching your mouth in those areas, you will know and appreciate how gentle you need to be to do these little circles on your dog. And again, if your dog has trouble with this, persevere. It's really important work. And it may take several sessions, just doing a tiny bit like I did just now, to have your dog allow you to do this work with them. And again, it's really important to do this work if you've got a dog who is excessively barking, biting, snapping at the air, nipping at people's feet, or, chewing up their toys, or chewing on their own paw. If they are going to be requiring dental work or have had dental work, this is a great thing to do with them. It's very good for emotional upset. Now, while your dog is shaking and shivering and being emotionally upset, like for instance during a thunderstorm, not the best time to do mouth work. Would have been a much better idea to do that mouth work before the thunderstorm. And have your dog familiar with that, so that when you know the thunderstorm is coming, you can do a little bit of work on his mouth to help him relax. It's a really good thing to do if your dog is fearful when he goes to the vet, because of all the different smells there and that emotional distress that he might feel there. Even if he's calm, like Tristan, he's quiet. He has a great time at Dr. Judy's office, don't you, Tristan? And he gets treats and everybody says he's cute, but it still has a lot of smells that can be fear-inducing. So it's a great thing to do the mouth work to help your dog release any stress he has about going to the doctor. It's a great thing to do for licking and nervousness and stress. So I would do mouth work if I had to drive, for instance, like 6 hours with my dog and he did not like being in the car and was unable to sleep quietly. He might be quite stressed when I arrive. So I might pull over, every hour or so, or have somebody with me to do some mouth work and ear work with the dog while you're traveling, if that's stressful for them. Are you stressed? He says no. So these are some of the things that you can use the mouth work for. Now, the other important thing about the TTouch Mouthwork and the ear work, what is between the mouth and the ear? Where's my skull? We have, do you have a good angle there? Yeah. So we have the ear right here. That's where you're going to be doing the ear work, is on the ear. And then the mouth is here. And what's in between there is your jaw. And if you have an animal with any kind of, I mean, I've seen dogs that are so stressed they like jitter their jaw together like this. And if you have a dog that does anything like that, the ear work and the mouth work together are really effective to work with the jaw. And as I said, that connection between the jaw and the reticular activating system can keep a dog in a state of stress, or a horse or a cat. So it's really important to do the ear work with the mouth work if you've got any kind of a problem going on with your dog's mouth, because the jaw literally just hangs off the temporal bone. So anything that's going on in the ear, you can use the ear work to release some of the temporal bone so that this jaw will have a nice, soft, happy thing to hang and swing on. So if you've got a dog that has jaw problems, it's really important to work on the ears. And the same for a horse. I had a call this morning about somebody who is working with a dog with vestibular syndrome. And we didn't talk about that so much yesterday with the ear work, which it's directly related to. But the mouth work and the ear work are really good things to do if you've got a dog with balance problems and he has been diagnosed with vestibular syndrome, which is really a lack of coordination and balance, as well as sometimes nausea with eating. So it's really important to work the ears of a dog that has a vestibular problem and do it very gently. Often they have a lot of restrictions in their neck. So all of the TTouches that we have talked about, the lying leopard, the clouded leopard, python lifts, licks of the Tao's tongue, can be really effective to help free up that neck. And you can teach the dog's owner to do these things as well. And then doing the mouth and the ear work for these poor guys that have vestibular syndrome. And there are a lot of medications they give for that, some of which are more effective than others. And my specialty is certainly not medications. But there is usually a strong structural physical component to this that a pet owner can do a lot to alleviate, as I said, using a lot of the TTouches that we've talked about so far. So I believe that the mouth work and the ear work are two of the strongest things in your TTouch arsenal to help so many problems that you might come across with your dog. Biting, barking, licking, emotional upset anytime in their lives, nervousness and stress. And these are not always the first things we choose to do. Now, my dog has these beautiful, long, soft ears, so he gets a lot of ear work. But as I said earlier, I haven't worked with his mouth probably more than twice a year in his life, except after he had this problem when he was a younger guy. And so it's a good idea to remember that. And to that end, I want to talk just briefly about the importance of having a healthy chemistry in your dog's mouth and having good, healthy teeth. You do not want to have an older dog, especially little dogs that have acidic mouths, that require to be knocked out when they're 14 or 12 or 15 years old to get dental work done because of the bacterial buildup on their teeth. A lot of this bacteria can get loose in the dog system and create a lot of health problems throughout your entire dog or cat. So to that end, my sister, Dr. Judy Morgan, has developed, using deer antler velvet from Australia and New Zealand, something called Dr. Morgan's Dental Drops. They are available on her website. They'll be available on my website when it's back up and running next week. And it's $30 for a bottle of these, but it can save you thousands later on in your pet's life when you have to have any kind of, knocking them out anesthesia to work on their teeth. So the teeth will be healthy and shiny, and I can't emphasize enough the importance of these dental drops. They are really wonderful. And do not accept any imitations. Recently, the dental drops were attempted to be copied by another company, and we have no idea what was in those bottles, but it was certainly not the same formula as in the dental drops that my sister has developed. So check out those dental drops on her website or mine next week when it's back up and running. And you just put a couple of drops on the top teeth up here once a day, and it helps really kill the bacteria in the animal's mouth. And it's got cinnamon and peppermint, so if you've got an animal with really bad breath, this can be really helpful. I have a new client coming next week who's a cat with some pretty significant autoimmune problems with teeth that are falling out, and they are recommending that he lose all of his teeth. And I said, oh my gosh, please don't do that till we have tried the dental drops. And of course, what did she have but a allegedly veterinary prescription model of dental drops, which are woefully ineffective. And I said, oh, please stop using those right away and come over and pick up some of these other ones. So I will let you know how that cat is doing as time unfolds. But, you know, it's really important to have your animals have good, clean teeth. And some breeds are prone to problems with their teeth more than others. And a diet, of course, can go a long way, a good diet, to having your animal have clean, healthy teeth. But even so, Chihuahuas and some of those breeds are just so prone to problems with their teeth. So really important tip, check out those Dr. Judy Morgan's dental drops on her website or mine next week, and use them for your cats and your dogs. This is Sally Morgan. Today we've been talking about TTouch Mouthwork, and this is Tristan the Corgi. And I am a craniosacral therapist, a physical therapist, and a Tellington TTouch practitioner for animals and people. And this has been another episode of Conversations with a Corgi, where we have looked at mouthwork and the limbic system for your pets. And we will be back tomorrow at 9:25, where we will have a special Conversations with a Corgi, and you will see what that's about then. Thank you so much, and have a great day. I don't know if you can see out the window up here. It's been snowing sort of heavily during this entire talk, and we have quite a bit of ice and slush on the ground. It's not a good day to go out and run around, so we'll be staying inside. Maybe we'll practice some more mouth work. What do you think, Tris? Have a great day.